cancers, health issues. Now this toxic load is what causes them. So we want to, again, as a biological dentist, we want to figure out ways to remove any source of toxic load. So if someone has root canals, you shouldn't freak out. You should just get it checked out.
Yeah.
That's what I would say. Just get checked out, see what's going on, and then go from there. Don't rush to.
All right, guys, we got Dr. Ben here from MySmileBody. Thanks for hopping on today, man.
I'm happy to be here, Sean. Thanks for having me.
Yeah, biological dentistry, upcoming space, right?
Well, you know what? It's getting more and more recognized for the importance as far as overall health, longevity, and vitality. It's been around for a while. It's not brand new, but it's, like you said, up and coming because it's more recognized now in the health and wellness world.
I remember when I went to dentist growing up, I never even considered this an option. I never even knew about biological dentistry.
Most people don't. It's pretty rare if I meet someone and they know what that means.
Yeah. So we should start there. Could you explain what actually biological dentistry is?
Yeah. It's, if you think of functional medicine, like you go to the doctors, there's naturopaths and functional medicine, it's like an alternative route. It's very much like that on the dental side. So that's the first way I would describe it. There's some pillars of, that as far as how we think as biological dentists and what lens we look at when we actually see a patient that's different. For one, we look at the body as a whole. Like in other words, current medicine is diagnosing patients in silos. Like you have a heart specialist and they just look at the heart, and the skin specialist just look at the skin, right? So for us as biological dentists, we look at the whole body. And we look at the connection between the mouth and the teeth and how they affect each other. For example, you can't have a healthy mouth with a toxic body. And if you have if you're trying to have a healthy body and you have a toxic mouth, there's a problem there too, because then it doesn't work that way. So we're very focused on that, and also materials that we use and restorations and all the treatments that we do. Like you talked about root canals or metals or any source of infection that's coming in the body. So there's a constant source of toxicity that comes in the body from every angle that we look at. Like you talk to Papa's hosts, so many toxicities coming from every angle. So it's so for us, our role as biological dentists is reducing that toxic load, and a lot of times that toxic burden that people are living with every day that's affecting every aspect of their health, vitality, longevity throughout their whole day, their energy levels, their focus, my brain fog to autoimmune disorders to cancers. A lot of times that's related to our health.
I know when Papa came on, he said he didn't see a single patient that had a massive health issue without a tooth issue as well.
Oh, absolutely.
Isn't that crazy?
You know what? It's crazy when you hear it for the first time, but we see it every day. And you can talk to people at oncologists that are really looking at the body as a whole, and they'll say that about root canals or infections. When I first time I heard that blew my mind. It was years ago, and I was at a lecture, and they said, if you find someone that has cancer, they are very likely to have some kind of infection in the mouth. Not very likely, like it's 50% or 60%. They were saying like 100%. Now you just say 100%. So they either had some kind of infection going on that's a source of that toxicity that's leading to that chronic disorder, chronic disease of some sort.
Makes me wonder, because I just found 2 polyps in my nasal passages, and my root canals had a cavity. Like all of them have cavities. So it makes me wonder, like, damn, I should really get these out.
Well, it depends on where your goals are. At the end of the day, we're all busy. We're all working hard. We're all doing something we're working on. And without our health, what's not worth much, right? And sometimes now we have, people that are looking for their health through biohacking and detoxing and having, these systems of health and longevity and vitality. The Gary Breckers of the world and all these people, and they're starting to see, okay, we have to look at the mouth, because we can do all the liver detox we want, if you do all the heavy metal detox, but if you have a constant stream of toxicity still coming in the body, you're only going to go so far. The analogy I give is, imagine you're in a room and there's a pipe broken, water's coming in, and you want to clean it up. So you start putting towels in the ground and keep toweling, but it's toxicity. All the water still keeps coming until you shut off that valve. You're not going to get very far.
Right.
So if you're trying to get healthier and you constantly have source.
Hey guys, shout out to today's sponsor, Kinsta. Running an online business is already a challenge. Your website hosting shouldn't make it harder, and I've been there, dealing with slow load times, confusing dashboards, and unreliable support. That's why I switched over to Kinsta, and it's been a game changer for my brand. Since moving to Kinsta, my site loads faster, runs smoother, and I don't have to stress about downtime. Their intuitive dashboard makes managing everything simple, and their 24/7 expert support means I always have real people whenever to help when I need it. Kinsta's built for performance with blazing fast speeds, enterprise-level security, and 37 global data centers to ensure your site reaches audiences quickly. They also handle free migrations, so switching is effortless, and if you ever get a traffic spike, Kinsta automatically scales to keep your site online when it matters most. I'm not the only one who trusts Kinsta. TripAdvisor, NASA, Indeed, and over 120,000 businesses rely on Kinsta for their WordPress hosting. So if you want hosting that works, just make the switch to Kinsta today. Get your first month free. They'll even handle the migration for you. Just visit kinsta.com/DSH to get started. That's KINSTA.com/DSH.
Toxicity coming into your body, you're not going to get very far. Same as nutrition, right? If you're eating toxic foods, you're not going to get healthy.
Yeah.
But the same is true for your mouth.
Speaking of toxic foods, what are the worst foods you've seen lead to poor dental health?
Well, poor dental health is the same as poor overall health. Same thing, same food, same everything, right? So I would say there's a few main foods that you probably heard from maybe other guests that you should not have that are important for overall health and for oral health. Right. Same thing. So number one, obviously, and not in order of priority of the, obviously, wheat and gluten.
Yeah.
It's inflammatory, causes a lot of dysregulation throughout the whole body. Sugar, obviously, not all kinds of sugar, but processed sugar. But obviously there's dairy, the conventional dairy. If you get good source dairy, it's different. And of course, there is the seed oils. Seed oils and processed foods in general are probably the biggest one. Seed oils are a biggest culprit of health issues in the country.
Damn, seed oils, huh?
Oh yeah,
Not detrimental.
I mean, and by far, if you look at the trends in as far as health issues in this country, as chronic health issues, diabetes and cancer, everything that as how it's been kind of increasing over time, the graph follows exactly how the increase of seed oils had one. Exactly. So not with the fact that at one point days carbs were the worst thing. Another time it was like sugar, and another thing is fat. That has kind of changed all this time. Like you got to not have fat. At one point it was like you got to not have fat at all. Fat free this, fat free that. And then it was like sugar is bad, but none of that really matters that much. Really, honestly, it's the main thing is going to be the seed oils is the biggest culprit by far, and that shows up in your mouth because guess what? When you're it's systemically unhealthy, it shows up. And if you look in the mouth and someone has no inflammation, no bleeding, no cavities, even if they don't ever floss or they don't brush their teeth that much, it's possible because if they're actually have a healthy lifestyle and if they have a balance, what we call microbiome, right? The oral microbiome, which is bacteria in your mouth, that's like your gut microbiome. That's the second highest volume of good bacteria in your body is your mouth. And so, if you have that balance, you're fine. Even if you have poor hygiene, you're still going to be fine.
Right.
A lot of times in the dental world, we focus on hygiene too much.
You think so?
Oh yeah. I mean, it's important. I'm not saying it's not important, but it's not number one in this.
Not for long. Have you ever seen someone reverse a cavity?
Yeah. I mean, a lot of times if the cavities are, where you show up, like today, I was, seeing a patient. I was at the office right before I came here. So, when we're diagnosing cavities, if they're, shallow enough, they're not that deep. There's different ways of reversing it. There's a hydroxyapatite now, and then we use actually a really cool tool called Ozone. Have you heard of Ozone before?
Ozone therapy, right?
Yeah.
I didn't know that was for cavities.
Well, you know what? It kills bacteria on contact.
Oh, wow.
So it actually is much stronger in killing bacteria than antibiotics.
Damn.
Much stronger, like thousands of times.
I'm trying, the side effects aren't as bad as that.
There is no side effects. It's just oxygen.
Wow.
So it's just something that's been around for ages, actually. The integrative doctors have used it for ages. But In the world of dentistry, biological dentists use it. We can use it for a lot of things. Like we ozonate our water system throughout the whole office. So when you get a cleaning, you're getting ozone in your mouth.
I love that because most dentists do not do that with their water. They use probably tap water, honestly.
Tap water is even worse for you. Oh my God. Imagine you're getting cleaning, it's just tap water there everywhere. No, they don't have a filtration system on the system. But yeah, we ozonate every inch of every little bit of water, every drop of water that goes in your mouth. And then when you're getting cleaning, now you're not only scraping off that stuff, but you're going to be killing the bad bacteria, because the bad bacteria, don't forget, don't like oxygen. The good bacteria love oxygen. So bad bacteria don't like oxygen. So you want to get in there, and you, when you use the ozone to clean, you're doing a much better job than you can with just scraping the stuff off your teeth. But again, for surgeries, we use it when we go in and clean out an infected area, or even for fillings where in area of a cavity, if it's a shallow cavity, you can ozonate the tooth structure. And if you ozonate tooth structure, it literally kills the bacteria that's causing the cavity on there. And it'll just stop where it is.
That's exciting, man. Because I know a lot of doctors, when they use the fillet, it's actually microplastics and like harmful materials, right?
Fillings, obviously everyone now knows that the mercury fillings are horrible, right? Heavy metal toxicity, mercury. It's more than 50% mercury. Still being used though.
Oh, they still use that?
Still being used.
Wow.
In this country, still being used. I was up. So I guess, sorry. It was it. No, it's a really sad situation with that, because you're in Europe, a lot of countries, Russia banned it in the 70s. A lot of countries have banned it. Here, they're so okay with it to be placed for some reason. I don't know why. Hopefully, with new leadership, we'll get some change in that direction as far as health goes. But this mercury, since we're talking about mercury a little bit, it is the most toxic non-radiographic material that you can use, and that's on Earth, and it's more than 50% of it is in the fillings. Now, we can, as dentists, cannot utilize or remove mercury in the mouth and let it go down the drain.
Really?
That's easily, we can't let it go down the drain, bro. You have to have something that an analyst separator. So you got to separate it before it goes down the drain, because it's that toxic for the environment.
Wow.
But it's okay to put it in the mouth, and when we're drilling it, obviously all the vapors that are going through, it's okay for the patients to breathe it and doctors to breathe it. But obviously for us, biological dentists, because we're cognizant and thinking about this kind of stuff, when we're trained to think about the materials, we will go and get trained on the proper removal techniques. So we are protected, the patient's protected, right? And of course, we're not exposing everyone in the room and everyone in the building to mercury vapor, which has causes so many health issues, contributing to that heavy metal toxicity that it causes all kinds of neurological disorders, cardiac disorders, and neurodegenerative disorders. It's amazing.
Yeah.
And so we use.
I can't believe that. I mean, when you look at these firefighters, they don't have the longest life expectancy because they're breathing in all these harmful toxins, right?
It's a sad situation there, of course. And even though if they're in the fires, they're going to be wearing some kind of masks and so on and so forth. And for us, when we do the mercury removal, we have a special mask. We don't use a regular mask.
Wow.
There's a special mask that looks like these big,
like the movie.
Yeah, hazmat mask. It literally like hazmat mask, because it's super toxic, and dentists are being exposed every day, every single day, and patients. I always tell patients, don't go remove your mercury fillings. I did a post on this topic in our social media that said, do not go and remove mercury fillings. Why? Because if you just go to the local dentist and just get them out, that's what happens. You're going to get usually more sick. You have to get it done correctly.
Yeah.
So it's super important.
And a lot of dentists, I'm just now finding out they do root canals incorrectly too, right?
Well, the root canals is a, controversial topic. I'm personally not a huge fan. I used to do a lot of root canals. I used to do got extra training to do root canals. That's how you were doing right. After dental school, I went and got more training to do root canals even better, because I'm the kind of guy, if I'm going to do something, I want to do it right. I don't want to be just doing it, to get paid for it, and move on with my life. For me, I want to do it at a high level. I want to do it at a specialist level. I don't know. I'm not a fan of root canals anymore at all, because of the what I see and what current research shows. And so if the patient really wants to do a root canal, I'll refer them out, just because it goes against my belief system now at this point, to a specialist to get it done. But overall, I think there's better solutions.
Thanks. You're that against them.
Oh yeah.
Wow. Because mine are like sideways and they penetrated my gum, and they've been telling me to get them out for 10 years. So,
I mean, what I would say, if someone has a root canal, the most important thing you do is get it checked, and get it checked by a biological dentist with a cone beam CT scan, which I don't know if you ever had experience where you come to the office, we're going to do it for you. It's a scan that is a 3D imaging, like what a CT scan, go to the, it's you see 3D, you can see the slices, you can see detail. It's so important to get that done because there's such a high rate of infection. Patients have no pain. We do these scans consistently on any patient that has had a root canal, for example, or as part of our new patient protocol with this kind of scan that we do. And so every new patient, we pretty much want to check and see how everything is doing, because there's other infections that you could find on this kind of scan, something called cavitations, and that otherwise it's pretty impossible. It's fine. So that really convinced me that I don't want to do it anymore. When I started scanning everyone, then I just see the results, right? Oh man, the volume of efficiencies.
I heard it's almost everyone that's got a root canal.
If you watch this documentary called The Root Cause, have you seen that, Bauer? It's a really good one to watch. You should watch it. It talks about a study that was done where I think 1,800, don't quote me on that, but I think 1,800 teeth were extracted, and they checked to see, actually how much factor is leaking from these teeth, and every single one was, holy crap. So for me, if I scan a tooth and I don't see a bit of visible sign of infection, I don't tell them they have to take it out. I just tell them, these are pros and cons. It's up to you. If it has visible signs of infection, then it's priority. That's one of our number one priorities of that, to get this out, because this is a source of toxicity that's leaking in your body every day, contributing to your toxic load with other toxic burdens in your body, but now leading to autoimmune disorders, cancers, health issues. Now, this toxic load is what causes that. So we want to, again, as a biological dentist, we want to figure out ways to remove any source of toxic load. So if someone has root canals, you shouldn't freak out. You should just get it checked out.
Yeah.
That's what I would say. Just get checked out, see what's going on, and then go from there. Don't rush to I have root canals. I have to take them out.
What are the most common issues you're seeing right now in your patients? Is it cavities?
Well, I don't have an average patient pool. Our patient pool is not typical patient population. It's more of the patient population that is very health conscious on health and longevity and vitality, and we're usually sought out by them, so they come to us from not our local geographic location. Most of our patients are coming from us from far away.
Wow.
So they either drive, a lot of times driving for hours to get there, or flying. We have a lot of patients that fly in, and because we have a set part for traveling patients, because we can do things that other dentists generally are not doing right now. And because they've researched for this, and they found someone that does this, they find us and they've come to us. So our average patient is not the average patient in the United States. So what do we see? We see the patients that are looking to detox their body. They're looking for, they have health issues, or they're looking to achieve a better health, to go to the next level as from wherever they are. And now they're realizing that, for example, biohackers, they're healthy, they just want to go in a better place now. So they'll go in, and Bill comes a lot of time. We'll go in and assess them and see what's going on. And they might not have a lot of cavities, but they might have other sources of infection that they didn't know about, or a source of toxicity coming from different kind of metals that are used in dental restorations that you don't need in your body. Any metal in your body, forget about mercury. Any metal in your body is causing inflammation, is a block in the natural meridians in the body, the electrical systems that are naturally going through the body. The metal blocks that. And another one that a lot of times people don't know, metals are blocking, or actually not blocking, but actually attracting EMF, electromagnetic, which is, it's like an antenna. Imagine you're an antenna. You have all this metal in your mouth, you're an antenna for EMF. So, so we are looking at everything from that lens when we see patients. So we're looking for source of tox. When I see a patient, I'm looking, okay, what are your health goals and what's happening? Our new patient protocol is like, we talk about a lot of things beyond teeth. I spend a lot of time on nutrition and what's going on and what you, like we just talked about nutrition. But really, I do start talking about what's going on with their health. Yeah. And what their goals are and where they want to be. And we created a facility that we can encompass and do a lot more. We haven't gotten to the facility yet. When you come in, you'll see we do a lot more than just dentistry in our facility. So that's it.
Yeah, I saw the website. You guys have a lot of stuff. I was really impressed because I've never seen a dentist office have all these arrays of things.
Well, you probably won't. There isn't really much of that out there. We kind of come up with a new concept when we built this facility. We felt like since we were doing biological dentistry for a long time, we realized that we have to not only complain about the current system, but we got to come up with a better solution. So our solution was, we have to collaborate with more like-minded professionals, doctors, naturopaths, nurses, pediatric dentists. We have, other dental specialists that think like us and work all together to achieve better health for patients all around. Not just, because again, it's not just about your teeth. It's not just about your systemic health. It's about collaborating, and that collaboration results in much better outcomes for patients.
Right. So you take their blood work too and everything.
Oh yeah. We have an MD on the team that's an integrative doctor that's, thinks like same as us. And, he'll do his own consultation to patients. And obviously part of that consultation is diagnostics like blood work. Yeah. There's different kinds of diagnostics that you can do. And at that point, and then it's how do we move the needle and get the patient to a better place, whether it's, where, their health, significant health issues or just weight loss. Or anything that can move the needle for them to get them to a better place. But it's a team effort. It's not just a specialist here. Go to that office now. Go to this office. For us, it was like, let's create something that's actually more collaborative, and we can get much better results for patients.
I love that, like a one-stop shop almost.
Yeah, I mean, you can think of it that way. We even have a holistic esthetician on the team because skin health a lot of times is based on just caping on stuff or just doing some kind of peel or something like that. For us, it's, again, if you come from the right angle, you're getting healthier from within, and then you get better skin and better teeth and better hair and better everything.
Yeah.
Like everything improves if you actually get healthy from within. But if you do something superficial, and you might look healthy on camera or look healthy from far, but really you're not healthy.
Duh. I wish I knew that when I was a kid struggling with acne. I tried so many washes and creams and they never worked. No one ever told me to go within filler.
That's the future. Right now we're heading in a really great direction as far as healthcare, health and wellness in this country. The pendulum is swinging in the right direction. People are really starting to ask questions about their health, and not just following the direction of a doctor. I always tell patients, don't follow my directions. Ask questions. Challenge me. In fact, whatever I say, don't just go do it. Go research what I'm saying. Go and get you're informed. Because at the end of the day, what my biggest message to my patients is that you're the driver of your health journey, and I'm here to support you. I'm not here to tell you what to do. I'm here to help inform you and help you in the right direction.
Yeah. When you were in med school, do you have questions? Like, were you questioning the system at the time, or did they see years afterwards?
I'm whether it's in dental school or med school or now, because education never ends. We constantly go to courses, and there's always something else we want to learn. My brother is my partner, and we go to all these things all together always, and we're the ones that are always asking questions, man. Our hands are always out.
Oh, I can't question.
It's like but what about this? But what about that? But what about this? But it's so you have to ask questions. I feel like our society is going to be a lot better if everyone starts getting the habit of thinking and not just following. You have to think yourself and see, does this make sense? Does this, is this something that I want to do for myself? Is it resonate with me? do some research, put some time and effort into it. And no one is going to come save you. That no one's going to come just tell you what to do. I remember I spoke at our conference one time, and it was right before the election. I said, either way, whoever wins, no one's going to save you. At the end of the day, the only person that's going to save you in your life is you. You have to decide what you want for yourself and go after it, whether it's your health, well-being, longevity, or career, or whatever it is. It's what you do with that life and what opportunities you're given, that's going to make the biggest difference.
Yeah, I agree, because insurance won't cover this. You can't rely on the government to cover your health.
I did a post on insurance.
Oh, yeah.
Dental insurance, particularly because I'm a dentist, so we deal with that mostly. And I think it's a fry. It's a totally scam. The dental insurance, people think they should rely on it. Oh, I didn't go see this because I had insurance or something like that. You only get $1,000 to $2,000 a year, and that's it, right? So if you want to get, let's say, a crown done, you're already pretty much past that. But if filling, a couple of fillings, you're going to be past that. It doesn't make sense, because insurance should be for, catastrophic loss. Let's say medical insurance, like if you, God forbid, get cancer or get in a big accident, you don't need insurance for little things, right? If for a doctor's visit, you can pay for that out of your own pocket, but if you have catastrophic loss, you want to be covered in an emergency situation. But dental insurance is the opposite. It only covers little stuff, but it doesn't cover big stuff.
Yeah.
So it doesn't make sense at all, actually.
That's why I didn't get it, to be honest.
You shouldn't get it. What we do in our office, besides having systems for payment plans and financing and all that kind of stuff, we're launching a membership plan. We're getting membership plans because it's a much better answer than insurance that covers just a little bit. For us, then it's very clear for patients that they can actually be supported and make things more affordable.
I'm a fan of membership plans. My gym at home, lifetime membership. My podcast studio is a membership plan.
It makes sense. It makes more. Everything is kind of going more in that direction, and so it just, because it makes sense. This system, this insurance. It's just
It wouldn't surprise me if it was a scam, because did you see what happened with Social Security yesterday?
No, I didn't see that.
So Elon Musk revealed the numbers on the age brackets and how many people in those age brackets were getting Social Security. There was millions of people above the ages of 150 years old claiming Social Security. So our tax dollars are paying for those people.
Wow.
It's basically people that died, but their family's still collecting it and you're reporting them still alive. There was one guy that was like 300.
Wow.
Crazy.
Crazy. It's crazy. I mean, I don't get it. I mean, without getting political, I don't. It seems like you having this system of going and investigating these systems in the government, that, because we all know government is overspending on everything.
Yeah.
And that's our money. We work so hard every day to pay our bills and then taxes.
Yep.
Right?
Cali out here, you're only like 50%.
Yeah. I mean, it's like half the year you're working for the government, right? Yeah. So you think you'd care with, how the money's being spent. So why not have someone audit it? We have the IRS to come audit us at times, right? So why not audit the government? So anyway.
Well, if they're starting to audit and they're failing. I had to go on top.
Pretty down. We already knew that was going to happen.
Yeah. No, it's just nuts though. Seeing the money, dude. It's infuriating, because you and I pay millions of taxes. So it's like, wow, that's how it's being spent.
Well, yeah, we kind of knew that it's being overspent. Anything the government does, it's messed up, as far as like, oh, we're going to build a bathroom, but it's going to cost $5 million to build a bathroom. You heard stories like that. There's so much corruption of people being, pocketing money, and where is this money going? It's not for bathroom.
The pandemic was nuts, because I was selling PPE during the pandemic, and just seeing what the government was paying for like masks and gloves, it was crazy. I'm sure you heard some stories.
Oh yeah.
Oh yeah. Couldn't believe it.
Oh yeah. It's just, there's so many stories like that. Even the PPP monies that rolled out to people that, some of the money that was sold out and geared out to people, it's like, there was no organization, so much money being wasted.
Yeah.
Anyway.
Mind blowing. Meanwhile, companies like you could use that money.
I mean, listen, we're fine. We're excited for the next chapter. Again, I'm not a doom and gloom. I'm a super positive type of guy. I'm excited for the next chapter, for what's to come. I'm really excited for Bobby Kennedy I've been a fan of his for a long time, and we're excited for what he's going to be hopefully bringing to the table as far as health community services and in some of these agencies. Hopefully Doge is going to do some good things out there too, and it seems like already gotten off to a big start. And either way, we have to do our part. Again, I'm a big believer that we can't wait for anyone to save you, right? So for me, it's like, okay, what am I doing every day for myself, for my family, for my community? That's how you're going to make change. It's what you're doing yourself every single day. If you're waiting for someone else to do it, we're not going to get too far. So for us, that's why we built this new facility. And with that, okay, we got to do something different because the system is broken. We call it, but really not broken, because it's actually made this way for a purpose.
Right.
So it's really not broken.
It's working for them.
No, we spend more money, as you know, on healthcare than any other country, way more. And we provide more prescriptions to people, to Americans, than any other country by far. Yeah. Did you know that every adult in this country, by average, is on 4 to 5 prescriptions a day? A day. So that means if you're 18 years or older, wow, your average adults, 45 prescriptions a day. That's so young. So it's like it's crazy. So it's not by accident. This is a system that was set up this way. And what we can do is try to make a difference. And that's why we created SmileBody, to come in and go, okay, well, how can we get patients healthier from within? Without prescriptions, without doing invasive procedures or surgeries. In general, I'm talking about the medical side and the dental side collaborating together and to get better results. Sometimes surgery is necessary.
Embarrassed situations, but they're so quick to jump to it these days. I see it with my athlete friends who are like, oh, you need surgery.
Again, it's the future is bright. There's a lot of good things happening. I'm really excited about what's to come next in the world of health and wellness. And again, if we all keep pushing in the right direction, I think we're going to have amazing results.
Absolutely. Can't wait to check out the facility. We'll do a part 2 there, walk through all the procedures and stuff.
Yeah, you're going to love it.
Yeah, I'm excited. Where can people find you, man, in the meantime?
Well, our handle on social media is MySmileBody, and also our website is MySmileBody. So all of our social media is actually MySmileBody. So you look for us there, and I put a lot of content out to try to get people informed about this kinds of topics that we're talking about today, and more, and a lot more than that. And because again, if people don't know, they can't make changes. So my goal is to get people knowledgeable about all this, people knowledgeable about what this kind of new perspective on health and wellness and healthcare would be, as far as biological dentists and other healthcare professionals working together as a collaborative. So I'm excited for this next chapter, man.
I'm excited to see you change the narrative, because a lot of people are scared of dentists, but I think you make the process a lot more fun and manageable.
Well, it's an understandable fear, because think about it. When you're young, you go to the dentist, your first painful experience is going to be at the dentist, getting a shot. Oh God, horrible. Getting a filling, drilling in your mouth. That fully invasive experience of someone in your personal space. There's nothing good about it. But for us, it's a matter of making that experience a lot better. Not only through just listening. Start out just listening to the patient. It's you would think that's a given, but how many times patients tell me I've never had any doctor listen to me this long.
No, if they just shuffle you in.
We sit with the patients and we just talk about what's going on, and nothing else matters at that moment. I'm not in a hurry, and just by that, right, makes a big difference. And then we put a plan together for them. And then when we want to do treatment, we do something called sedation dentistry. So when you don't have to be suffering and white knuckling and going through these procedures, we do different kinds of sedation. Obviously, there are sedations where you can be put out with the anesthesiologist. We do that. But most common, it's sedation with something called oral conscious sedation. It's a pill form sedation. And you, let's say, are getting a dental implant. And we do ceramic dental implants because we want you metal free. and we want to do that surgery, no one wants to go through that. But if we do it the right way with this oil constipation, you're sleepy and loopy when we're getting the work done, and you're not realizing what time passing. And next thing you know, I put the chair up and we're done. And the patient didn't even realize we started.
Wow.
But the whole time we can actually talk. Like, how you doing, Sean? Are you comfortable? It's like, you're listening to music and you're just kind of in a happy place, but you're not really experiencing it. And all of a sudden it's all done. So for us, each step of the way, we want to make sure you have a good experience.
Love it, man. We'll link your stuff below. I'm sure people will message with some questions. Thanks for coming on, man.
I'm excited to be here again and seeing you at the office.
Yeah, next time, part 2, guys. Stay on the lookout for that. See you next time.